Hey everyone, this is Dr. Caleb Kauffmann with NorCal Physiotherapy. Today we're going to be talking about foot pain, specifically plantar foot pain. That's pain on the bottom of your foot. Now notice I didn't say plantar fasciitis. There's more than just a plantar fascia on the bottom of your foot, and all those structures can be affecting what you feel on the bottom. So to go over a couple of those structures, first of all, you have the plantar fascia. Starts here at the medial calcaneal tubercle, and it goes up along the bottom of the foot, helps support the arch, and attaches at each of the toes. It's a tight band of connective tissue, so we can't activate it, we can't stretch it. Generally, when that hurts or when we get that diagnosis, it's because something else is acting on it. A couple other structures that we have the muscles in the bottom of the foot that I think are most important. You have the quadratus plantae, you have the abductor hallucis, you have the flexor hallucis brevis, and you have the flexor digitorum. All these muscles can get trigger points, they can get nasty, irritated, and they can cause pain in the bottom of your foot. Now notice where I'm pointing. These spaces here are typically where people say they have pain when they come in with a diagnosis of plantar fasciitis. So instead of directly trying to treat the plantar fascia, maybe we take a step back and say, let's treat the muscle that's causing the plantar fascia-like symptoms. So the plantar fascia, muscles. The last thing I want to talk about and show you is the joints, or the joints of the foot. The first one is the talocrural, where the tibia and fibula attach to the talus. Then you have the tarso-metatarsal, and they have the metatarsal phalangeal. Now these are very interesting because it typically goes in a pattern of too tight, not enough movement, too much movement and irritated, too tight, not enough movement. So when this doesn't move right, the motion has to come from somewhere, and oftentimes it's in the midfoot or that tarso-metatarsal joint. When this happens, there's too much movement, the arch collapses, we get irritation at the plantar fascia, we get irritation at those muscles. So how do you fix this stuff? And that's what I want to show you today. Just a couple quick things that you can do to get started. The first thing we want to do is decrease the pain. We can't start working on muscle activity or strength or anything if you're having pain. So the first step is to decrease that. The problem is the pain is often so much down here that we can't touch it, we can't work on it. So a good way to start is to work on the muscles above. Oftentimes the calf muscles, the gastroc, the soleus, the tibialis posterior, as they come down, they're super tight and irritated and they're giving pain into the foot. So relaxing here is going to help this feel better. Easy way to do that is to grab a ball. You can use a tennis ball, a lacrosse ball, racquetball. I had a patient use a skateboard wheel, anything that rolls and can apply pressure. So put the ball down and find some nasty spots on the calf and just start rolling up and down, back and forth. You want to apply a little bit of pressure, not too much. Don't go so hard that it's hurting you, but go hard enough to feel a little bit of discomfort. Once you find a nasty spot, hold it there. Do ankle plantar flexion and dorsiflexion. So we're getting the muscle to move underneath the ball. All right, after we do that for a little bit, then we move up to the foot. All right, and we're pretty much the same thing as we did there. The ball on the ground, foot on the ball. Start with rolling back and forth. Make sure you hit all those four muscles that we were talking about. Find a spot, do some sustained pressure. Find that spot again and do some motion. So toes going up and down, toes going out and in. Just get some movement and try to get the muscle to move underneath as it's being compressed by the ball. Okay, so that should help decrease the pain. The next step is that we want to fix the underlying cause. And like we said, joint mobility is often limited in the talocrural. It's increased in the tarso-metatarsal, decreased in the metatarsal phalangeal, but it's really hard to be specific on mobilizing those joints by yourself. So we're not even going to touch that. What we want to do is show you some actionable content to make sure that you're doing this correctly and getting the improvements that you need. So we're going to I want to show you some muscle activation techniques and strengthening for the foot. So the first thing that we're going to do is get the toes moving a little bit. This is a little difficult at first, so take your time, make sure you understand it, and then progress it. The start of the exercise is to push down your toes as hard as you can against the floor and try to pretend there's a bug under your foot and you're really trying to crush it. As you're pushing down with the big toe, I want you to lift the other 4 toes. So push here, lift up. Now we're gonna do the exact opposite. Push with the 4 toes, lift the big toe up. And that's all you're gonna do. So push, lift, hold for a couple seconds. Push, lift, hold. All right, the next one is a short foot exercise, and really the name of the exercise describes what you're going to be doing. You're going to make your foot short. You're not going to bend your toes to do that. You're going to slide your toes back. The goal of this is to build up the arch. So there's not going to be a lot of movement, but you should see a little bit of the arch building up. So as I pull back my toes, you're going to see this lift up just a little bit and hold it there. My goal is always to hold for 7 to 10 seconds and then relax. Pull back and hold and relax. So when I do this, I feel as though the muscles inside of my foot are going to cramp. The first couple times you do this, just like that first exercise, you're not going to feel too much because you don't know how to activate those muscles yet. But as you do it more, you're going to start feeling that a little differently. Once you have these 2 down, then we want to progress into standing exercises, because we don't run, we don't lift weights, we don't do much with our foot sitting down, so we want to try to get it as functional as possible. So we're going to integrate that second exercise, the short foot exercise, into a standing exercise. So standing up, 1 foot in front of the other, your weight is going to be on the back leg. You're going to build up that arch with that short foot exercise, shift forward, and then stand up. And so what you should be feeling is the muscles in the arch trying to work and trying to support your foot as you go from an unweighted position to partial to full weighted. Now if you look closely, what you're going to notice is that this replicates the gait cycle. We step, our muscles fire, we shift our weight forward, we come into mid stance. And it has to support ourselves here. All right, so those 3 things are really important and a good place for you to start on any ankle. Those 3 are very good to start with any foot issues. Of course, we can't diagnose over a video. I don't know if you have plantar fasciitis. I don't know if you have a Liz Frank deformity. I don't know what's going on. So the best thing you can do is to go get checked out and make sure you have what you think you have. So the next thing you want to do after that, we decrease pain, we improve the muscle activity. You want to integrate that into movement. When you start going back to deadlifting, squatting, running, don't overthink it, but try to think about using those muscles a little bit more. As you do that, you should see that the posture of your foot changes, the posture of your knee changes, you have better form, and you're actually able to lift heavier and run further. Hopefully this helps someone. If you have any questions, email me, text me, call me, leave a comment. Thanks.